I can get started with, while we wait for our other panelists, just in explaining what my title really means. So, Deputy Sector Navigator, what is that? So, I am a grantee of the California Community Colleges at the Chancellor's office, at the Chancellor's level, the state level. And so, what they do is they invest dollars in economic and workforce development. And what they've done is they've said for each sector, we're going to provide a sector navigator. And so our sector navigator is Sandy Slivka, who is also at Miramar College. Let me see. There it is. Okay. So our sector navigator, and so our sector is life sciences, biotechnology. And so we have a sector navigator, and she's our leader. And then we have what we call deputy sector navigators, which are in the regions. And so I am here to work with all of the community colleges in our region that have life sciences biotech programs, which include Southwestern, Miramar College, which is where I'm hosted, City College, and Maricosta College. And Grossmont also has some career exploration course for high school students during the summer, and they sort of embed their biotech into their regular biology program, but they don't have a formal biotech program. And so I really work on behalf of all the colleges here. And so what I'll do is I probably have enough business cards for everyone to take one. So I would encourage you to take one. And if you have any questions about anything that I'm going to say today, or you'd want some information, please email me. And I'm also happy to meet with you one-on-one if you want to know more about this industry, okay? And I'm happy to do that, and that's the best part of my job, so please come see me. Okay, so I'm just going to go ahead and pass these out. So hopefully there's enough there for everyone. So in many ways, I'm here to if you're a person that a student sitting here saying, yes, biotech is for me, I'm going to reinforce your decision, and you're going to feel great about the direction that you're headed. And if you're here sitting in the audience thinking, maybe not, maybe I'll convince you to try it, okay? And so what my job here today is to really set the stage for you, to give you a sense of what the life sciences biotech industry is like here in San Diego. So why biotech? Why life sciences in San Diego? I would say the very first reason would be because it's a high-wage job, okay? It has the opportunities to pay high wages as you increase in both experience and in education. So what do I mean by that? What I mean by that and how we calculate this is a lot of the information that I'm going to provide to you is we've done research, and it's called labor market research. So because I'm also a trained, I have a master's and a master's and a bachelor's in biochemistry, but my doctorate is in science education. So I've done research in an academic lab, and so when I came to this position, this whole idea of conducting labor market research was really cool because it's just another type of research. In science you're using data, but you're looking at more of economic models, and you're pulling on wage data and job openings. But in the end, it's data, and it can be analyzed, and I love data. So high wage, right? So what does that mean? It means that you can afford to live and work in San Diego. It means that the job that you're going to have is going to pay you enough to live in San Diego. There are other jobs out there that don't necessarily do that, that the wage that you make isn't enough to allow you to live in a particular place that you want to live. So that's the number one reason why I would consider a position in this field. Number two, it's in high demand, particularly here in San Diego. So what does that mean? It means that over the next 5 years, we're going to experience a 28% growth in this industry. So not only do they pay well, but there are jobs here in San Diego that are waiting for you to be trained with the skills and the knowledge so that you could fill those jobs, okay? And I'll give you more data as we work through this. So high demand. The other thing of why I would choose life sciences biotech is that it provides, these are pathway jobs. And what do I mean by pathway jobs? I mean that you can start as early as a high school graduate. You can work in a biotech life science company as a high school graduate. You're going to be the glass washer, and you're going to have a very sort of minimum wage or close. It'll probably be above the minimum wage, although San Diego is getting up there, right? I think we're almost at 10 or something like that, like $10, $11. So that's what you're going to start. But you're going to start in a pathway. You're going to get your foot in the door into the life science industry, and you can begin to build your way up one rung at a time or several rungs at a time if you wish. So more experience, more education, more money. Then you get more experience, you go back for more education, you go to the next level. So you can go all the way from starting at making $11 an hour, let's just say, all the way up to $11 an hour to like $37 an hour. Okay, so it gives you the pathway, it gives you mobility, and that's a great industry to be in. Okay, and then the other component of why I would argue that this is a great industry is that, I don't know, I was driving over here, I'm like, what's the word? The only word I could think of that I'd like to think of is you're contributing to global good. What do I mean by that? I mean that, you're helping people that are dealing with rare diseases, that are dealing with fatal diseases, that are dealing with diseases that they have to manage on a day-to-day basis, okay? And you can be on the ground level of that. You could be one of those team members at any of those levels that I just described, because a glass washer has a very important job. That's where I started. That's where a lot of other of my colleagues started, as a glassware washer. Because without the glassware being clean, experiments can't be done. Without a tidy lab, experiments can't run. Okay, so it's a matter of perspective, and so you could be contributing to that global good. And these companies take their products, their medicines, their drugs all over the world. It's not just for here, for California or the U.S., but they're going to Mexico, they're going to China, they're going everywhere, and they're impacting people's lives in a positive way internationally. So that's why I think it's very rewarding, and you would be contributing to a global good, and that's what I mean by global good. So how are you all convinced this is the right industry for you? All right, then I think I've done my job for today. All right. Okay, so then now let's look at some numbers, right? Because a lot of people can talk, but you really want to ask always for the data. Where's your proof? Where's your data? Show me the data. So here we go. So I'm going to have to manage two of these controls because this one doesn't have a pointer and I need my pointer, so bear with me. Okay, so here we go. So I told you that there was going to be 28% growth in San Diego, right? In San Diego Imperial County. So what we have here is here in San Diego, so San Diego is one of 3 hubs in California. That's the other great thing. Like, say you want to move somewhere else, but you want to stay in California, there are 3 places that you can live and work that the same things that I just described as to why it would be a good industry would still work for you. The Bay Area, LA Orange County, okay? Now, the types of jobs, when we get into the LMI, the labor market information, that's going to shift slightly, and I can send that information because the jobs are going to look differently. The pay is going to look differently, right? Because it goes back to that living wage. People in the Bay Area are going to make more. Why? Why? Because it costs more to live there, right? Okay? So the numbers are going to look a little different. The wage is going to look a little different, but the same will hold. High wage, high demand, pathway jobs. And rewarding. Okay, so San Diego is one of the hubs here in California, And nationwide, we are ranked 6th in research and labs. That's how many jobs we have here in this area. 10th in medical devices, and 10th in drugs and pharmaceuticals. So the other statistic that I don't have on here that I'll speak to is our location quotient is 1.4. Now, all of you are hopefully in the sciences, you understand density, right? The density of something. So our location quotient is 1.5. What that means is in our region, if we compare the number of companies, by the way, there's about 500 life sciences biotech companies here in San Diego. So if you compare the number of biotech companies or life sciences companies in our area, in this region compared to other regions nationally, one would be that we're up the same. Okay, so we have a 1.5. That means our region has many more, much more, and that's a really big location quotient in terms of the number of biotech companies here. Okay, so I hope I've convinced you that the jobs are here, okay, and that we're ranked nationally, and that we're one of the 3 hubs here in California. All right, my other one. Okay, so the next one is, okay, so now that I've shown you the data about, where the jobs are, then what's the breakdown, right? So where can you find the most number of jobs? So the most number of jobs are going to be in scientific research and development services, which is 50%. But if you combine that with this here, which are college, university, and professional schools, so in other words, colleges and universities in our area, we're rich in academic institutions here, right? Have UCSD, San Diego State, University of San Diego, plus the community colleges, San Marcos, Cal State San Marcos. So all of those academic research institutions are conducting research, and they also have positions, okay? So if you combine that with this, over 60% of the jobs are going to be in sort of a laboratory assistant technician type positions. Then we have the next group is medical diagnostics, and then pharmaceutical and medicine manufacturing. Okay. Okay. Now this chart has a lot of data on it. So this is where I was talking about the 5-year projected growth, and this is called labor market data, okay? And these are this data uses data from the past, right? Because it looks to the past to project for the future, because all we know is the jobs that have been, from previous years. So then this is all based on projections. And so here, the other thing about these titles here is that these are occupational codes, standard occupational codes. So that's another thing I had to learn when doing labor market research. So this is how the federal government sort of classifies all the jobs out there. If you're a company, you have to say, okay, what are your SOC codes? What kind of occupations do your employees have? But that doesn't necessarily mean that this is the job title that people have, right, in their actual job. So there's a little bit of disconnect. When we do the research, we have to use these codes, but then in the next slide, I'll show you what the actual job titles are, okay? So what I want to show in this slide is a couple of things. So up to now, I've been really focusing on life sciences biotech, but another area is medical laboratory technicians, okay? So let me start there since I focus so much on the life sciences biotech. So a medical laboratory technician, their training is a little different because it's a state licensure, okay? You have to pass a state exam. You have to maintain your license. There's other, you have to get a CP with something called a CPT-1 license, and we have a member here on the panel that can speak more to this. And so here, this is a more like very direct path, right? So I take my program, 2-year, probably it'll take you 2 years, pass the board exam, pass the exam, maintain my license, and then you go and you look for jobs that have a medical, that need a medical lab technician, and you're going to see that they're going to say a license required. So that's a very specific sort of one-to-one match. I have my license, I look for jobs that require the licenses, right? And so right in here, you'll see that in terms of the projected annual openings, they're looking, there's going to be jobs, right? So 26% growth there over the next 5 years. And look at these wages. So when in your packet, you actually have something that I like a lot better. In your packet, you have wage data that's going to give you the breakdown. Very similar, it's this chart, but sort of expanded. The reason why I like this is because this gives you the median hourly wage, the 25th percentile, and the 75th percentile. So what that allows you to do, because this is median, that means like you've gotten the job and you've been in the job for maybe a year or two, right? This is not going to be your starting. So I'm all about transparency with students. Your starting salary is going to be closer to the 25th percentile. That's where you're going to start, and then the 75th percentile is sort of the high end once you've got more experience and more education. Okay, so when you look at that data, think about that in terms of where you're going to start. Okay, now, the other thing about this slide is right in here, the biological technicians and the chemical technicians, this is where an associate's degree is going to be the degree that you're really going to want in order to sort of move and then eventually get a bachelor's, okay? So I just want you to be aware that there's a various, because I said, you know, you can go from high school to graduate degree, and I have another slide and we'll go deeper. But this is where you're really going to, if you wanted this kind of a job, you're going to want to focus on your associates and your bachelor's. Okay, now, manufacturing, look at this. In terms of the wages, manufacturing is the wave of the future, right? How many of you know that Maricosta Community College is going to be offering a bachelor's degree in biomanufacturing? Okay, it's the only one in the state. Why? Because we know biomanufacturing jobs are on the horizon and they're well-paid jobs, better than you know, working in a lab. And look at it. I mean, it's right here. It's in the wages, right? And this number is small right now, but it's going to grow. Okay. And then related to that is this category here: inspectors, testers, sorters, samplers, and weighers. And that's a lot. That's related to manufacturing, right? You're sorting things. You're inspecting the quality of things, of finished manufactured products, right? And look at that growth. 123, 35% chemical technicians, 52% increase in jobs. Okay, so there's the data. Okay, so let's go. How am I doing on time? 2 minutes. Ooh, okay. So I'm going to quickly go to my next slide. So I just want to show you, I talked about the actual jobs. So when we use something called burning glass technology, and basically it's a search engine that searches the internet for job postings, essentially is what it is. And so here they are. So we go from these occupational codes to what are the actual job titles, and here they are. Lab assistant, specimen accessioner, manufacturing technician, right up there again, quality assurance. Look at the number of jobs with quality, okay? Quality. When we interviewed our industry folks, quality. You're going to need quality in the future. It goes back to manufacturing, right? You're going to manufacture a product that it has to meet certain quality criteria, okay? I'm going to speed up, and you can always contact me. So if you feel like you're missing something, just email me, call me, come visit me. Okay, and then I'll end with this slide, and this really gives you the data behind those pathway jobs I was talking about, right? So if you're a high school graduate, what kind of job title are you looking at? What is my hourly wage? If I want to move into a biotech certificate, here are the job titles. By the way, in terms of manufacturing, Maricosta is the only community college in our region that really focuses on biomanufacturing. So if you wanted to do that route, I would encourage you to look towards taking courses there. And then, again, your hourly wage, and so you move, higher degree combined with experience, higher wage. And you can see how the job titles change. And then, this is a mistake here. Okay, so I forgot to write the yearly wage salary, but look at this. This is with experience. And my parting message to you is, if I wish someone would have given me some advice when I was sitting here, is that that experience counts just as much than education. At the end of the day, what industry is looking for is your experience. What can you do? And combining experience with education is going to help you move up that ladder. Okay, not just education, but no experience. Because I will tell you that there are some students that graduate with a bachelor's degree that have to start somewhere over here because they don't have the experience. So they have to sort of start them from the bottom up. I think I've gone over time, but thank you for your time. Feel free to email me or call me. Thank you. And now we're going to hear from our panelists.
Well, hello, everyone. Good morning. My name is Marlies Fischler-Barraza, and I am currently teaching a few classes here. So Bio 211, 206. Bio 211 is molecular, Intro to Molecular and Cell Biology. 206 is DNA Science 2, and an Intro to Bio 101. Okay, so the department here wanted us to talk a little bit about the opportunities that you can have in this sort of field, and what would you actually be doing, in practice after you've been here for, taking a few classes, a few semesters, you get a certificate, or if you decide to move on to a 4-year degree. My particular experience, I've never worked in industry, and there'll be people here that have a little bit more experience within industry. But my particular experience has always been in academic labs, including my graduate work has been, obviously in academic. But the time that I was working was also in an academic research lab. Okay, so, and there's a lot of opportunities for you, the students, to, like Dr. Banyala said, to start working even early on, before you get a certificate, or before even just, volunteering. If you have a few spare hours here and there, like she said, experience does count a lot, and it will show. At the end of the month, when you get your paycheck, it does show where you start off with that wage that you're going to start off getting. And I just wanted to give kind of a few ideas of the types of things that you could do, maybe just with, but with an associate, with a certificate. You could do cell culture, which is something that some labs, I think, especially in industry, and again, there'll be other people that will have a little bit more information about this. Cell culture is something that's very, cells need to be happy. If they're not happy, they don't work like you want them to work. So you need to make sure to keep those cell cultures. If you're working in industry, the labs, the amount of cells that need to be cared for are way more voluminous than they are in a research lab, because in a research lab, academic setting, everybody has kind of their own cells that they take care of and should take care of. You could also do husbandry and colony maintenance. So you have some organisms that you work with, mice, rats, some larger animals that some research laboratories use, sheep, dogs, horses, etc. You can also help with creating transgenic organisms. Drug discovery and production, right? So you get to kind of have a hand in all these new products that'll be coming out, right? Understand how the products And like Dr. Bernal said, it'll be kind of a nice contribution. And that's part of the reason why I like science, because we're part of a global community and we get to contribute a small piece of knowledge for every little thing that we do, even if it's, even if it's finding out how things don't work. So sometimes people get hooked on, which is, the idea of understanding how something works, but sometimes understanding how something doesn't work is as important as knowing what works. And again, biological sample and management, okay? And the types of skills I think that you would need to have to stay in this industry is one that you always, and not just this industry, but in general, you always need to stay current. And it's something that, we as researchers kind of have, it's been ingrained, we just always have to keep on reading. We might kind of have a project going, but if a paper came out and figured out something different, we need to stay current and be able to kind of manage those. And you also need to be a good technician. Whether you have a certificate, an associate's, or your PhD, you have to be a good technician because you need to be able to switch gears. So if you're doing something and it's not working, you need to be able to say, okay, well, what can I do? Why is this not working? And how can I make it better? Okay, so that part of optimization is always a constant presence in a research laboratory and biotechnology in general. And Dr. Bernieros went over the salaries, and so, I had kind of that same, probably you created that information. You start kind of off lower 30K a year, and you move your way up, as you get experience. I think I worked at UCSD for 4 years. So I started off, I think, $12 an hour, and after I left, I was at $18 an hour. That was with a bachelor's. And I used to work at Ralph's, and I thought, well, the cashiers at Ralph's make $18 an hour. It's like I went to school for 4 years, and I'm making 12, But then, you get that offset. You have more experience, you go to school a little bit more, and you kind of renew your sources of education and so forth. So, and I think the other panelists will have kind of a little bit, Dr. Buehler will definitely have a little bit more information about the biotechnology program here on campus. So,
thank you, and welcome everyone. My name is Lucas Buehler. I'm a professor in biology here at Southwestern College for a full-time professor for the last 8 years, and was an adjunct before that. And I started here in 2004. Briefly where I come from, I'm born in Switzerland. I did all my studies there, and I came here to San Diego because I got a job opportunity at UCSD as a postdoc, which my PhD advisor in Basel had contacts with, and so I slipped in there with these connections. And as a matter of fact, when I think back about every job I got, it's because I got them because I knew people who knew other people who had an opening, and so I never depended on sending out mails to job searches, which is a very, very hard thing to do. So I'm here and I joined here, and I had a mostly academic experience. I never knew what my hourly rate was because I always worked in jobs that where hours didn't count. You just did as much work as you could to finish a job on time, right? And so to look at salaries is important. But it's not the only aspect. One aspect I want to highlight here is that certificates matter, degrees matter. These professional certificates are important, right? It gets you in there somewhere. Everyone has to start at an entry-level position, but then you work your way up. But the most important thing I learned from my experience is that when you think about, well, which direction should I go? Which certificate should I take? Is it important if I'm a general biology major or a pre-med student or a biotech major or an engineering major? It's important because you choose this because that's what you really like or think you like best. Then you find out within a year or two, maybe that something else is more important, but it doesn't often matter because the skills you pick up in academia before you end up in somewhere working for industry or in a government agency, this is also a lot of stuff available there. You end up picking up skills. And the biotechnology program that has been started here by Dr. Nuna Bakit is really, really well focused on these particular skills that you pick up and that industry people actually value the most. And that is being detail-oriented, and that is knowing how laboratory research works. And no matter what project you work on, these are transferable skills. These are skills that are transferable beyond the degree, the name of the degree that you have, right? And so this flexibility, you don't have to think too much about flexibility, but if you're right now sitting here and you think, well, I just want to figure out what to do and I don't know where I end up, then yes, you don't have to worry too much about where you end up, but first focus on, is there a degree, a certificate, a program that matches my interest very well? Go into that. That makes it easier. If you do something that you don't like too much, then you end up frustrated and fight for grades, right, and stuff like that. So, and later on, once you have a bachelor's degree or even a master's degree, you can go into often a completely different field. Because what degrees really show you is that to someone else, okay, you went through an academic, rigorous program, and you accept that this program was rigorous because you don't have to know really what happened at this time. And so the certificate alone, a master's degree, you can go anywhere in the country or outside the country, right? I came here with a PhD in biochemistry, and PhDs are made for worldwide recognition. Master's programs are worldwide recognition. So the job that colleges do in accreditation is that once you went through a program, you know that you have a solid program that most people will accept as a quality certificate, right? And the quality behind is of course you yourselves too, because your skills that you take serious will then translate into your job experience when you work yourself up the ladder. When you have a skill, when you have an interest, then you will make it up and get from this low salary maybe to hopefully or eventually to a higher salary. Right? So I did one stint for 2 years at the local biotech company, the Johnson & Johnson Research Laboratory. It was all relatively basic research, but really was medically oriented in terms of the drug discovery. Right, the technical skills are split up into very highly specialized people. I was doing one very little specialized thing, but I was trained for that for many years through my PhD and postdoc time, expressing ion channels in a frog oocyte, right, and analyze the data. And someone else, chemists, hundreds of chemists, they throw together molecules, and then you take some of them and throw them into a culture and see what works, right? What Biotech actually is doing is just trial and error. You throw things at stuff, and what sticks comes out. And sometimes I sit in a seminar with hundreds of very smart people, and I look at all of them and say, whoa, there are thousands of smart people in this city, San Diego alone. Like you mentioned, it's a big hub of biotech, the Beach Biotech hub, right? And why don't we make more progress faster? Because there's so many smart people, many times smarter than I am, obviously too. So I don't know, biology, okay, it's very difficult. It's very difficult to find something that works. But that's a nice challenge. I like this about the challenge, and I also like this because I stayed in academia and found my way into teaching. I was on the way then also started out with starting on E. coli bacteria on cell membranes and cell walls, and then went into neurobiology, and then went into cell biology, and then into this drug discovery with synthetic peptides. And then I discovered there was a time where bioinformatics came up, and DNA microarrays and data analysis. I'm also a fan of data analysis, but there's way too much out there that you can do. So if you start somewhere here and you pick up your skills, you take them seriously, once you have your certificate, once you have your step in a door of a company, then you can, or a research facility, or you go into the government facility, or you work for NASA maybe as an astrobiologist. I think physicists always talk about life outside Earth, and there are very few biologists who actually are very interested in life outside Earth because it's such a far step away. That's my personal impression, right? So to be a little bit more specific, I want to just highlight a few things that you have in your brochures about these biotech programs here. The websites are everywhere. You can inform yourself about the details, right? But I want to highlight a few things that I think are important features that you should keep in mind when you make a decision about your own life, because you know where your strengths are. Everyone I have seen working in a laboratory who didn't like it, within 2 months, you know exactly that you're not made for laboratory research. There's no doubt, right? You hate coming in the mornings, and it's a terrible life. When I was a postdoc here at UCSD, I liked my research. There was a grad student. He suffered 2 years because he hated the experiments he did. Every morning he came in and he hated the job. And then after 2 years, he convinced himself and his PhD advisor, my boss, that he rather works in molecular biology rather than an electrophysiology experiment. And within 1 year, he had already a paper published together with the lab because he found the right way. So when you have opportunities and you're ready for them, pick them up like that, right? And that's very successful. So if you like these programs, take them. The Biotech program here is very good because they teach you skills. Skills are, right? They sound boring, but like you said, and the speakers say, a clean glass, a sterile glass, a sterile pipette is important because if it's not sterile, you can go back, throw everything out, and start from scratch, right? If you made it yourself, I washed a lot of glass myself. I never did it for most other people, but I did it for myself. And every time you get a solution that someone touched and you didn't know what they did with it, you can't do it. You have to restart from scratch, right? So when you end up in stuff like that, then you are responsible for many other people. And if you make them happy, they are happy with you, and you have an interesting life. So record keeping, documentation. At the Biotech program, okay, and that's the strength also of Dr. Bakit, is that she tries to get you into becoming a TA. You become a teacher yourself as a student for other students who enter the program later on. And this is the best way of actually learning your stuff and finding out what interests you. And you will do a lot of writing, you will do presentations, and you will work as a team, but you also struggle on your own with your own project, troubleshooting, right? How to learn to troubleshoot. This is something I appreciated more and more when I did my biochemistry PhD. I did every possible mistake you can ever do in a laboratory, no matter how stupid it sounds, but once you're not paying attention, you make a stupid mistake, right? But you learn from that very well. And so now I'm teaching cell biology laboratories, and something doesn't work, right? Something doesn't work, then I often see myself, not very often, luckily we have good technicians, but I can troubleshoot and say, oh, something like this went wrong, try it again, but you did this wrong, or this went wrong, so and then it works. And this gives me a lot of, that's something I like about my job as well, that I can actually put in my own experience into the teaching. And organizational skills, and with Dr. Bakit, also resume writing is a big important part, because one focus on this program is that there are not too many people in here, right? And now that the financial situation gets better in California, the pressure on eliminating programs that have only 12 students instead of 45 is gone. So we can actually provide a quality education for those people who want to do it. We don't have to train 35 people, half of which are not really interested in it. That's a waste for everybody's time and money. That's my opinion. So anyway, so career opportunities, like I said, it's transferable. Once you figure out 5 years from now that you learned is not really what you want to do for the rest of your life, go somewhere else. You can become a lawyer, you can start your own business. Okay, you can so you can become forensic scientist, you can become a reporter that covers a Supreme Court things about forensic DNA or hair analysis, which is now in the news about it. What is hair analysis that people have done has convicted a lot of people for wrongfully, right? Because the evidence was just crap, dog hair instead of human hair, but it was not done properly. So thank you. My time is up. Anyway.
You guys mind if I stand up? No? Okay, cool. All right. My name is Dina Reinacher, and I'm the program director for MLT and MedOp, which is Medical Office Professions here at Southwestern College. I'm mainly going to focus today on MLT, which is Medical Laboratory Technician. Gloria had talked about that a little bit, so we'll go into a little bit more detail on exactly what that is. A little bit of background about me. I earned my bachelor's degree from Northern Illinois University a long time ago. Have about 14 years of bench experience, which was using my clinical laboratory science degree. I did 3 years of research in a research lab like these guys are talking about. Worked with the rats, worked with all that sort of stuff. Did my fair share of cleaning glassware as well. And then I decided to get my master's degree, which I got from University of Illinois in Champaign-Urbana, and have been in education ever since for about the last 8 years. So that's a little bit of background on how my transition went from beginning to now. MLT, Medical Laboratory Technician, does anybody really know what that means? Anybody have any idea? No? And I knew that was going to happen. Okay, so I know you guys have all been to the doctor and all had your blood drawn or peed in a cup at some point, right? That stuff goes somewhere, okay? It doesn't go to the doctor, it goes somewhere else, and it goes to a laboratory. And the people who actually do the testing on those bodily fluid specimens, and when I say bodily fluid specimens, I mean every body fluid that is imaginable, okay? These people touch it and test it and then give the results back to the doctor. There's a lot of data analysis that is involved also with that, so you have to like data also. If you're an MLT, you have to be very detail-oriented because you're talking about human lives at this point. When you get results out and they come out from instrumentation that you work with or any type of hands-on stuff that you do and you develop a result, you have to analyze that and make sure it's compatible with human life. You do a lot of diagnosing of diseases when you are in MLT. So if you like that whole sci-fi thing when you're watching TV and doing all that sort of stuff and how they figure things out, that's involved. You have to be able to process information, detail-oriented, which I mentioned already, but it's important. You have to be detail-oriented or people die. That's basically the bottom line. So you are involved in the healthcare system of saving lives. Even though you're behind that door with that biohazard symbol on it that no one sees and no one wants to go into, all those people that work behind there process about 80% of what is used in diagnosing, monitoring, and treating diseases in the human body. It's not your doctor. Okay, what they do is very important, but it also comes from a laboratory in 80%. Okay, so your doctor would just be guessing what is wrong with you if they didn't have the MLT or the laboratory scientist. Okay. MLT is an associate degree. We have that program here at Southwestern College. You earn an Associate of Applied Science degree. You can then take that and work in the field and work toward getting a bachelor's degree in clinical laboratory science. Gloria had mentioned that it's very important that you get and maintain a state licensure for California. Not only do you have to have state licensure, you have to have national certification in the form of either AMT, ASCP, AAB, whatever is out there. The absolutely fabulous thing about our program here at Southwestern College is we are NACLS accredited, and that is a national accrediting agency for clinical laboratory science. There are only 3 colleges in the state of California that are NACLS accredited. You cannot take the gold standard national exam, ASCP, unless you graduate from a NACLS accredited institution. So when you have someone who graduates from a college that is not NACLS accredited and they take a national exam, say the AMT, and then you have a student who graduates with the ASCP exam, they're going to take the ASCP over the AMT 99% of the time just because it is the gold standard. And we have that here at Southwestern. So that's one great advantage to that. You do have to have a California phlebotomy technician license in order to even apply to the program, and it has to be maintained up through graduation and when you begin your career. After that, it is basically up to wherever you work if they want you to renew your California license for phlebotomy. As far as the California license for MLT, you take that after you graduate and after you pass a national exam. You can't take it unless you pass one form of a national exam. And then you have to maintain that by doing so many what we call continuing education credits, which means you have to remain current in the field. That came from over here. You have to be current. You have to keep up with the new technologies. You have to do a lot of reading and a lot of additional test taking to make sure that you can continually save those lives, and that the instrumentation when it changes, methodologies when they change, that you're keeping up with that information. That's a broad overview of MLT. Here at Southwestern College, there are prerequisites that you need to gain in order to apply for the program. Once you apply and you're accepted, you have 18 months within that program. So our prerequisites range from microbiology to anatomy, physiology, inorganic chemistry, organic chemistry, some maths, and your phlebotomy certificate. So you have some work to do before you decide that you're going to try to get into the MLT program. We accept up to 30 students every single fall semester. Our application period is from April 1st to June 1st of every year. And then you are accepted into the program over the summer, and then you start in the fall. So every fall we enroll a new cohort of students. Our classes range from immunology, hematology, chemistries, urinalysis, microbiologies, blood banking, any type of clinical aspect you can think of that relates to what you need to learn in order to help diagnose and manage diseases, you will learn. You will take that knowledge that you gain in the classroom and you will apply it to clinical experience. So you'll go out into the field, you'll work in a hospital setting as a laboratory scientist, student laboratory scientist. You'll be working with actual human specimens and doing those types of things sometime throughout that 18-month time frame. Okay? Where can you work as an MLT? Obviously, I've mentioned hospital labs, right? So that's the main place you're going to work, but that's not the only place you're going to work. You have opportunities to work elsewhere. Research labs is one of them. I worked in a research lab with my degree, loved it, but decided that I wanted to go back and do other things. So you have research labs. There's physician office labs, smaller settings, usually 1 or 2 techs working. So if you like that small, intimate setting versus the big hospital lab setting, you can work there. There are pharmaceutical industries that will accept MLTs or MTs as well. There's a broad range of things that you can do with a degree in medical laboratory technology. The nice thing about our field, some may say it's not such a nice thing, but I think it's kind of a nice thing, is we're in hospital labs open 24/7, 365, right? So they need to staff it 24/7, 365. Typically, as a brand new MLT, you're going to be working that evening or that night shift. The nice thing about that evening or that night shift is called a shift differential. It can be anywhere between $3 to $4 more an hour just because you're working those crazy, crazy hours, okay? So that number that Gloria had put up, that's probably a day shift hour pay, so if you're talking about, there's a huge range for MLTs when you're hired, because if you're hired as a day shift MLT, you're going to make that $18, $20 an hour. If you're hired as an evening shift or a night shift, add $3 or $4 onto that. I only got 2 minutes left. Okay. Goes by fast. Okay. So let's see. What else can I tell you? Oh, I know I mentioned every body fluid, right? Okay. So if you're squeamish at all with any body fluid, this is not for you. If that doesn't bother you and you're like, all right, cool, biohazard stuff, body fluids, awesome, I can work with that, keep another thing in mind. As an MLT, you do not have patient contact. If you really desire that patient contact in the healthcare setting, this is not going to work for you, and you are not going to be happy when you go to work, okay? If you want to tinker with instrumentation and it breaks, so you need to fix it, so that's another thing to think about. You're going to have to be in those analyzers and things. Those are your patients, besides the tube of blood with the name on it. You do get to learn your patients very well, even though you do not have a face to the name. So you do tend to have that side of, I know I just saved this person's life because I just reported out this critical, and if I had not reported out this critical, this patient could have died. Because the doctor's not going to know what's really going on inside unless you tell them. Okay? So you have a very, very key, important job when it comes to healthcare. Is that my 2 minutes? Probably my 2 minutes. All right, thanks.
Good morning. How's everyone doing? Excellent. I like the call and response. So my name is Valita Jones, and I'm here representing University of California, San Diego. And I work on campus at a center. It's called the Center for Investigation of Health and Education Disparities. And I'm the program manager for STEM Education Initiative. And so how I got into that role is I actually did research as an undergraduate. I went to San Diego State. I have an undergraduate background in psychology and African studies, and then I did my doctorate work in education, both my master's and my doctorate. And I do research currently in consciousness and conscious awareness. But my research experience as an undergraduate was paid for. Were you guys aware of that? That you can get it paid for while you're going to school? So not only do you get your financial aid, you also get additional funding while you're doing research. And for me, I was lucky enough to be in one lab where we did public health kinds of issues. Our lab focused on providing data and knowledge so that they can change the laws in California about smoking in restaurants, so tobacco-related diseases. But so I received a fellowship from the National Institute of Health. And that's a huge organization out of the D.C., Maryland area that focuses on eradicating diseases and disparities among people. And so that's sort of what my center works on preparing students to move into research, reducing health disparities as well as education disparities. So anyway, while I was in that lab, I was able to get my funding, a stipend that paid me $898 a month, paid for all my books and supplies, and paid for 2/3 of my education. So I graduated as an undergrad with very little debt because I had that available. And then because I was also working for the state of California under this another grant, I was able to get an hourly wage from that as well. Everyone's not as fortunate to do something like that. I happen to learn to network. I would like to say that that's probably one of the best skill sets that I was able to acquire and competencies so that I can move into the role that I am in. And then I work now working with community colleges to help develop partnerships so the students can come from the community college to UCSD. I'm a product of the community college. I actually took some classes here long time ago, but I went to City College and transferred into San Diego State. But even better, I taught here in general psychology, introduction to psychology at Southwestern College. And then I currently teach at Cuyamaca College as well, a career development course. And then I'm an affiliated faculty at San Diego State University in the education department. So me having that research experience exposed me to a variety of opportunities and where I can go, because when you're trained as a person who is a researcher or have experience and knowledge with the scientific method, you know how to critically think, you know how to analyze, and you know how to be innovative and solution driven. So you'll be taught those things. Those are transferable skills that will go across the board in any jobs that you do. In fact, I made my own personal children do science research when they were in junior high at UCSD so that they can learn those skill sets. So my daughter, she'll be graduating next month from Cal State Long Beach in public health, but she was a student. All my children were actually students here at Southwestern College. And she was public health, biology here, and then she switched to public health. And now she's going to go back to biology because she says she doesn't like people. I told her there are people in the lab. She said, yeah, but it's different, Mom. They don't talk to each other. But they do. It just depends at the lab you're in. But the program that I have, I fund students, undergraduate students. I pay them $11 an hour to do research. So 20 hours a week while they're, in school, while they're on breaks, and during the summer, 40 hours a week. And this is money that they can get from the time they come in as a freshman all the way till they graduate. And they're brought into an introductory lab where they learn skills and competencies. So you don't have to even have these laboratory skills. We'll teach them to you. You will leave and you will know how to pipette until the cows come home. You will learn that. You will learn how to take notes, which you have to do in any position that you move into in the world. And I'm currently trying to introduce to my director a new way of taking notes, electronic lab notes, so that they don't even have to handwrite it now. You can just do it. You can set the lab up to do that. So they'll learn all their skill sets, they'll get training, and then they can go into a variety of labs on campus doing fantastic research in all different areas, from bioinformatics to bioengineering to nanoengineering to biochemistry to biology to human biology to environmental systems, chemical engineering. My students, on average, publish at least 3 papers as an undergraduate. And I have a student this year that has 9 publications as an undergraduate. When I left San Diego State, I had 1 publication as an undergraduate. And so that's fantastic because that opens up the doors for you to get into graduate school. And if you major in what's called STEM, science, technology, engineering, and mathematics, you will be admitted into PhD programs and you will have it paid for. So if you do graduate school and you're paying for it, you've done it wrong. and you want to do that because, if you're interested, whether you start later or early, I started later in life after I had 3 little people when I decided to go back to school and, did my undergrad and went through my master's, worked a little bit, and then went back and got my doctorate once my daughter got into 11th grade in high school. So you serve as a role model for those parents who are more adult learners. You're the best example that you can provide for your children. All 3 of my children went to college. They're all got their, bachelor's degrees. We supported them. They're on their own for their master's and doctorate, but they're all going to pursue them, once they decide what it is that they want to do. Now, again, I mentioned that our students are placed in independent labs on campus. We also have another aspect that we support 5 graduate students. Now, throughout this process, I work with the students both to make sure they get a lab experience, but I also do what I like to call career coaching, life coaching with them. I cultivate urban intellects. So I also help them figure out, well, what am I going to do after I get my doctorate degree? Am I going to go to industry? Am I going to go work in academia? Am I going to go create my own business? I like to push that idea because I think we all should create our own reality. And when you have that skill set coming from understanding, what it is to be a developing scientist, you can do anything in the world that you want to do. You just have to apply yourself. So, if to find out, about these different programs, because UCSD has a variety of them, we'll have a table later that you can come by. But we have several folks on campus with money waiting to give to students to help fund your education and, help you promote you and move you into other areas. You also get to do research. As an undergraduate, I traveled on San Diego State to present my research all across the country. And, to network at different conferences and learn skills and learn about people. We would go to these major student conferences where faculty would walk up to us and they're looking at our posters and they're saying, hey, I like what you're doing. Here's my card. Contact me when you're ready to apply. And it's sort of like a backdoor admissions almost of getting into their graduate programs. So make sure that you really check out the life sciences, biological sciences, because there's a lot of opportunities that are available for you. And like I said, later on I'll be at one of the tables and you can come by and speak with us. Thank you.
First off, I'd like to thank Dr. Banuelos for inviting me here. My name is Mark Lawson. I'm a professor of reproductive medicine at UCSD in the medical school, and I'm a basic scientist, and I run a research lab. They're conducting studies on how metabolism and neuronal hormones regulate the pituitary gland and in turn regulate reproduction. So that's very brief. I apologize for stepping in a bit late, but I made the mistake of walking through the lab on my way out. And as I am still a working scientist, I got sidetracked troubleshooting something with my postdoctoral fellow. So that's. And then I looked at the clock and realized I had to drive about 90 miles an hour to get down here. But what that also speaks about is something that I'm going to touch on later, is that I still love what I do, right? And I've been doing this for a number of years, and it's still an enjoyable part of my day to engage in research and science and in thinking about problems. As Dr. Mueller mentioned, working in science and getting, like he says, it's not an hourly thing. It's more about an avocation, something you just feel an urge that you want to do. So I'll give you a real quick little bit about my background, and I want to learn a little bit about you guys, because Dr. Jones has taught me the value of call and response. So my background is I ended up here in San Diego County when my father retired out of the Marine Corps when I was in high school, and I'm from Escondido, so I'm on the Norte guys, not the Southtown guys, and I did a little bit of thinking about what I wanted to do at a very late time, actually in high school. Applied to San Diego State after I'd already graduated from high school, and then got accepted, which I didn't think would happen. And out of fear, I went to Palomar College and retook all my math because I realized that I had kind of cheated my way through math in high school. So I spent a little bit of time at Palomar College. I went down to San Diego State. I took a degree in microbiology there. While I was there, I was actually working in a family business. I was a truck driver, and I only went to college part-time. So I had a very interesting appearance when I would show up in class, because I would be greasy and then try to do microbiology experiments. But nevertheless, I managed to finish that. But one of the things I did was I got involved in doing laboratory research, and actually my pure motivation was just to have extra money. And I was looking for a dishwasher job, and I ended up working in a laboratory getting paid to do a little bit of research, because the person actually who was our class valedictorian had beat me to the job. She got the dishwashing job, and I got the research job. So she's never forgiven me for that. We're still friends to this day, actually, so we've made up. But anyway, that got me interested in research, and then there came a time when I had to make a decision of whether I was going to stay working in the family business or go to graduate school. And after discussions with my parents, they were pretty excited about it, so they supported me in moving on to graduate school. Especially when they heard that, what, you get paid to go to school? Because graduate school is in the sciences, you don't pay for it. You're paid to do that work. So you usually get a stipend, your tuition paid, health insurance, and all that kind of stuff. You're not going to get rich being in graduate school, but you won't starve either. In graduate school, I enjoyed it immensely, and I ended up doing a postdoctoral fellowship at the Salk Institute and at UCSD. And then when it came time to deciding a career, and this is another thing I want to touch on real quickly, I actually took a job in biotechnology, and I worked in biotech just like Professor Bueller did, and spent a couple years at a medium-sized biotech company doing drug discovery research, which I found really quite thrilling and exciting and challenging, and a whole different aspect of science that I imagine many people would enjoy if they knew more about it. So I'd be happy to share some of that teamwork that was touched on, and applying skills to many different things all at once. But I'd had the opportunity to come back as a faculty member at UCSD to run my own research lab. And I thought really in the end that was something that I needed to do in to make myself happy, to at least try and fail at it. I would have to know, I would wonder, I call it a deathbed thing, when you're thinking about your life and you're wondering what you should have tried or not. And I was thinking I needed to do that even if I failed. So I went there, and so far so good. It's been about 15 years of being a faculty member at UCSD, which has been quite a thrill and really exciting. But one of the things I want to touch on then is a little bit about you here. So how many people here have thought about, say, medical school or graduate school? Okay, so you're still kind of toying with the idea, or you're ruled it out, or I know it's probably in your head and you're wondering about it. How many have thought about working in industry and pharmaceutical research and design and development of drugs? A couple of you? Okay, some of you probably don't even know much about that and don't know really what's involved in that. So that's one thing that you guys want to look into, because it's a really some people think of working in a pharmaceutical company as sort of turning to the dark side or the commercial side or something like that. But actually, you'd be amazed at the creative, motivated people that work in industry and how, you're really charged with, say, we want to find a drug or a therapy or something that will treat a certain disease, and how immensely motivating that is. And is something that's really quite different than working in an academic lab where you're working just based on your own curiosity. There's two different things. There's one common thing about that, is that if you like to work with your hands, how many here cook? How many here change oil in their car? How many here fix the broken computer? Okay, so there you go. So if one of the things that differentiates what you like to do early on that I've seen in my years of mentoring students is that if you really like working with your hands, then laboratory science is really something for you to do, that you should really think about it. Now, that's bench work, working at the bench, doing, wet work, doing biology, chemistry, whatever it is. If you're not so keen on that, you're interested in more the ideas, the data, how things relate to each other, then there's other fields that are entertaining to you. Bioinformatics was mentioned, systems biology, environmental biology. Lots of things are open to that innate bent that you have. Now, in all of those things, how many of you like baseball? Oh, come on. All right, I love baseball. And I'm not good at it, but I like it. But the interesting thing about baseball is that when you think about baseball, a guy who is in the bigs, batting 300, is having a career year. But what does really batting 300 mean? It means he's getting out 2 out of 3 times, right? He's only successful 1/3 of the time. If you can handle failure, and you're persistent in your personality, then that's another indication that you'll be persistent and successful in working in science. One of the most difficult things to mentor students is when they come in as straight A students or something, they come into a research environment, and they make a mistake for the first time in their life. And some people, they end up quitting science because they can't handle failure. Other people, which tend to be actually not necessarily the highest performing academically students, tend to be people that have actually worked with their hands, have dealt with failure, played sports, have overcome other hardships or things in their lives, tend to be more persistent. And so think about those things about yourself and what your experience is and what makes you persistent, and realize that those sort of life skills that you've gotten will make you better prepared for working in a laboratory and a teamwork environment. Now, there's one more thing I want to touch on, and I'll be here for after questions after that, and that is these jobs and these careers that are mentioned up here are good ends or even good places to go to think about what it is you want to do when you grow up. As I'm still doing, I'm still trying to think of what I want to do when I grow up. And many people that I've mentored and trained have gone on to industry and academics and done some of those traditional things. But other people have done things like moved into law school, moved into venture capital, moved into writing, moved into one of my greatest students and one of my favorite guys opened a brewery up in Pasadena and built a yeast laboratory by scratch up in the brewery up there that he's immensely proud of. But he learned how to do that by working in a biology lab. So. And then, of course, there's the traditional academics, locking yourself in a laboratory for a while, putting on some old school Jesus and Mary chain and rocking out and doing experiments by yourself. I mean, there's a certain joy to that. So not only should you think about the things here as ends on ends of themselves, but they're also stepping stones. I know I've mentored students who have gone on to do the bachelor's degree, become a research technician, and then realize, I'm really good at science. I'm going to go get a PhD and then go on and do that. And then return to industry later, but in a higher position with more potential upward mobility. So now they're going to be the boss, which is nice. So think of all of these things. Think about yourself, where you're coming from, what what you like and what makes you happy. Think about these steps both as ends in their own, but also as stepping stones to allowing you the time to think about what else you might do. And always keep your mind open to pursuing the things that make you happy. You're looking for a career, not a job. And so think about what that means and how that will support you in the long run. And then I'll be available for questions.
I was going to ask Professor Lawson, I'd like to ask about a little bit of an industry question about drug discovery and how was that experience? Because we had the luck to go see a company that kind of works in that, and it would look really awesome. I just wanted your take on it.
It is awesome. Just briefly, one of the things about working in industry in a team that's sort of developing drugs to treat disease is that it requires a lot of different skills. And even as you train in academics, I went in after having a PhD in postdoctoral experience, and I had skill in neuroscience and hormone biology and steroids and things, and that's why I was hired. But I was working in a team with chemists who, as were mentioned, were trying to use the early drug designing techniques for trying to design specific drugs. I was working with toxicologists who were trying to understand how these kinds of compounds would be metabolized in different animal systems in order to know how to produce a drug that won't be harmful, that will do more harm than good. And working with all of these people and not aligning your goals just with what you want to discover, say, in an academic setting, but how do you work in a team to develop something that meets a goal of trying to treat a disease is actually very interesting. You learn a lot about chemistry. You learn a lot about toxicology. You learn a lot about what the business of just how to go about doing that and how difficult it really is and how many years and what an investment in time and money it takes to do that. So I found it very interesting. I didn't leave that job because I didn't like it. I thought it was a very fulfilling job, and it was different than academia, but it was just that I had this other opportunity, so I had decided to go. So in the bottom line, if you like the idea of working with a team and you like working on something where it doesn't necessarily matter what the topic is, right, because you'll work on something, it'll work or it'll not work, but then you have skills that are needed in something else, and so you get transferred to a different project. And you get to use your skills to tackle different problems. If you think that that's something that you enjoy, then really it's something to seriously consider, and you do well at. But it's a good experience.
Thank you.
Thank you. We have a couple more questions.
Let me add to that. I actually work in drug discovery.
Oh, cool.
I've been working in that for the past 6 years, and it's everything Dr. Lawson was saying. In addition to that, the fun part, the best part about it is actually collaborating with other labs, other companies, traveling, getting to know how they do things. I actually work with a virus, so it's a little different on not using drugs, but actually using a virus to actually deliver a special gene to make a drug work.
Okay.
And that's what I do. I do a lot of animal work.
Wow.
But it's right. You do work with other teams. I work with 6 different departments, and I know a little bit of everything. Why? Because as a small company, we have to be able to jump into another group if that group needs us. That's the fun part that I totally love about being in research, is the fact that I get to learn a lot of things, not just pigeonholed into doing just molecular biology. I do molecular biology, cellular biology, immunohistochemistry, immunology, cancer biology, production, manufacturing. So I'm in every single aspect because I do work in a small company. And luckily, my students this year, I'm taking them to the lab to actually see the flow of how things work in industry, because I'm more industry-based. I like the academia portion, but I wanted to work on a bigger scale. I wanted to work with everybody and not just one section. So I moved into industry and haven't looked back. So if you want to know more about how that works, come and see me. I can definitely tell you. Oh yeah, I forgot who I am. Oh, I see all my students, so I think, oh, they know me. I'm actually an adjunct professor here.
Oh, okay.
Yeah, I actually teach for the Biotech program, so I actually teach the Introduction to Research 1 and 2.
Okay.
Next semester, I'll be teaching cellular and molecular biology, and I know some of my students are going to be taking that class. So if you're interested,
Okay.
but I also do, the reason I don't teach more classes is because I'm very research. I do a lot of research. I work 10 to 12 hours a day and then come here and teach. So it's all about, there's no hour, there's no 9 to 5. I work at 4 o'clock in the morning, no problem. I love blasting my 80s as I'm working in the lab by myself at 4 a.m. So if you have any other questions, come and see me. Yeah,
Cool,
it's a lot
thank
of fun. No problem. No problem.
More questions?
So this is more of a question for like the environment you work in. Originally, I came in here not really swayed to work in biotechnology. I'm trying to study dental hygiene, and the more I thought about it, I work retail, and I just don't like working with people in general. And I figure like if I'm going to school, why would I keep going to school to work with people as like another retail like person, you know? Like let me talk to this person, let me talk to this person. So do you have anything to sway me in the environment of working in a laboratory company? Because that's the majority reason I came. Also, I find it interesting because I'm taking all the prerequisite classes.
A lot of my friends actually who don't like that are bioinformatics.
Oh.
Nothing against Professor Bueller, but they actually like to be alone and actually work in clinical. That's another part. There it is. Talk to Professor Bueller.
Spring semester, 16, I teach bioinformatics.
And I want to take this class.
Contact me, there's some flyers out there.
There's also quality, there's other departments that Gloria had touched on, especially quality control and regulation. Those are you're on your own with your own project and you just kind of go in your own way. So that's something, we need a lot of quality control here in San Diego. Those jobs are paying really, really well. So I tell my students, if you don't want to work with people, this is the job and this is the salary. So go for it. But we do definitely need a lot of quality control and regulation.
You mentioned dental hygiene. The MLT prerequisites and the dental hygiene prerequisites are on the same road. They're exactly the same. So if you're trying, because dental hygiene, your job will be with a person in the chair, and if you don't like people, that's bad. So, but no, I know what you mean. Right. Like, in the laboratory setting, you're going to work with your coworkers, but your coworkers have the same mentality as you do with, okay, I don't really want to focus on the patient. I want to focus on their specimen instead and help them out that way. And then, like I said, the analyzers. So you're in an environment where you're working with the team, but you're also very independent because you will have your job that you have to do for that day, and you'll be very focused on that. And then the whole patient thing is not there. Yeah, sure.
So one of the quick things is thinking about going into academic research. So earning a master's or a PhD, especially a PhD degree, is really a reflection of what you as an individual have accomplished. Can you as an individual contribute to the overall body of knowledge? Essentially, that's what a PhD represents. And so it's very individually assessed. So you work in teams, you do a lot, you work in teams, you work in your laboratory environment, you do other things. but really your responsibility lies within yourself. And I do see the difference in people that I mentor where that's very important to them, that they want to be responsible for the work getting done or not, and don't want to necessarily rely on other people or do with that. And so there's actually a niche in academic research for that sort of personality as well. You can be very social and very successful, but people that like to just focus on their work and do their own thing. I was like that as a graduate student. It's a really good environment too. So eventually, though, you do have to go out into the real world and interact with friends and family.
I just wanted to ask to each of you, what's the most valuable or important skill that you've learned in lab?
When to let my mind rest and enjoy my family and the rest of my life.
I would say the same, but also how to analyze data and make data-driven decisions.
That's a really good question. For me, it's probably focusing on that detail-oriented, because if you make a mistake, people die. So it has to be able to really focus and work on what it is that you're working on and not let your mind get strayed by the bill you have to pay or the dog peed on the rug or, whatever has happened in your life. You have to focus on that patient and be very detailed with that.
Yeah, for me it was, I'm not really the hands-on person, so I did a lot of work with my hands, but what I enjoyed the most is when after 3 months of working hard and waiting for the things to come out the way I think it should come out, and then you get a good results, and then you get this experience of a really euphoric experience of thinking, oh yeah, I found now something how it works, and this was for academical, intellectually, that was for me the most important part, and helped me a lot to be patient with going through all of these daily things about you just have to do that and be systematic, and then at some point you get rewarded. Intellectually rewarded, that was the thing, and that's what keeps me also in academia.
For me, it was problem solving, and I think it's weird because I hated math in high school. But when I started college, it's like, oh, this is so cool. I'm going to take Calc and Calc 3 and continue on that. But I think really problem solving is the reason why I love science, because you get to go in, every day is new. You say, oh, weird, this was working yesterday, why is it not working today? Let me find a system, and like Dr. Buehler said, let's be systematic about what part is working and why it's not working, and if it fails, how can I fix that? So that you can apply to everything that you do in a lab, as well as the rest of your life and other work.
I think for me, I think back to my master's program in research, and I think that I learned the value of repetition and of following that SOP, because I had to repeat the same enzymatic reaction like over 100 times for my experiments, and it was the same thing and trying to get the results. And then, so the value of that in a lot of these jobs in the entry level, that's what you're going to be expected to do, and that's the foundation. That you're going to collect the data, back to data, right? That you're going to collect the data. And then related to that is you have all this data, and then how do you make sense of it? You have to make sense of the data, and then you have to interpret it so that it has meaning and value and can help you either answer the question you have in front of you or pose the next question.
Thank you.
And stick around. We have tables outside. Our panelists will be able to field maybe some more private questions. I think it was a great event, so let's give everybody an applause. Enjoy the rest of the day. Thank you.